Tracking COVID-19 in California, the state is now reporting more than 20,000 COVID-19 cases a day. But doctors say it could be much higher, with many people testing at home. COVID-19 is still a threat, but a new poll from the New York Times shows less than 1% of voters consider it a top priority. ABC 10's Morgan Reiner is live in the newsroom tonight. And Morgan, some say this is the worst variant yet.
Chris, it depends who you ask. One epidemiologist I interviewed said the reality in the U.S. is that up to 1 million people a day could be testing positive for COVID if numbers were right. Now, the other one said even if that's true, the severity of the cases, he says, is extremely low.
UC Berkeley School of Public Health professor John Swartzberg said he gets it.
I'm tired of the pandemic. I'm had it up to here with the pandemic.
But he said to look beyond the numbers to understand just how fast COVID is spreading.
A good way to know how many people are getting sick right now is to just ask yourself, do you know anybody with COVID right now? And already this morning I've talked to 2 friends. So it's pretty prevalent.
Cases and hospitalizations are rising in California, not deaths.
That's where the good news is, relative good news. By that, I mean the number of people dying in the United States now are 350 people a day. But multiply 350 or 300 by 365 days, and you're getting big numbers. Leading cause of death in the United States.
But USC public health expert Jeffrey Klossner said it's hard to trust the death count.
There was actually a report that came out on Friday from Los Angeles County Hospital where they have 24 people in the hospital that tested positive, but none were actually there for pneumonia or COVID symptoms. So our hospital data are very inaccurate, and that also means that our mortality or death data is not accurate as well.
I asked both, should people be concerned?
It's become very rare for people who test positive to end up in the hospital, to end up with severe COVID. And that's because the majority of the population has either recovered from prior infection or been vaccinated. And that immunity is very good at protecting people against severe outcomes.
I am concerned that there are a lot of people who are going to wind up getting long COVID. And we don't know what that's going to mean for the next year, 2 years, or the rest of their lives.
Both added that people with increased risk, like cancer patients, should be more concerned, but even they are pretty well protected if they are vaccinated, they added. Now, I'm told there is a newer vaccine supposed to come out in the fall that will not just protect people from severe symptoms, but prevent people from getting COVID in the first place, Chris.
Supposed to help with these new variants, right, Morgan?
Exactly.
Thanks, Morgan.